Welcome to This Explainer. Today, we're unpacking a massive new study on severe neck and arm pain.
So, you've got a pinched nerve. Do you go straight for the knife or stick to physical therapy?
This issue hits working-age folks hard, driving massive absenteeism and skyrocketing healthcare costs worldwide.
Medically, it's called cervical radiculopathy. Basically, a brutally painful pinched nerve in your neck.
We hit a major fork in the road here. Invasive surgery versus conservative care like physio and meds.
A brand new meta-analysis asks the big question: does rushing into surgery actually give you better long-term results?
Well, researchers pooled data from 12 comprehensive studies, spanning nearly 3 decades of treatments.
They looked at over 1,000 patients, tracking both surgical and non-operative groups for a full year.
They monitored critical stuff like arm pain and neck disability to see which path really performed best.
And here's the wild part. Long-term pain and disability outcomes? They were actually entirely comparable. This forest plot perfectly illustrates that fact. Look how the arm pain data clusters right in the middle.
Even with real-world metrics, like going back to work or taking painkillers, there was absolutely no significant difference.
So biologically speaking, both treatments actually interrupt the exact same inflammatory chain reaction. Kind of crazy, right?
Surgery physically decompresses that nerve root. It provides immediate structural relief by removing the offending disc entirely.
But get this, conservative care achieves similar goals. Medications powerfully suppress inflammation while targeted positioning relieves pressure.
Now, surgery definitely isn't useless, but its success totally depends on picking the right patient for it.
For younger patients, specifically under 54, starting off with conservative, non-operative management is highly appropriate and super successful.
But older patients with prolonged symptoms or major neurological impairment might absolutely need surgery if conservative care fails.
The big takeaway? These treatments aren't identical. Personalized care, based purely on your specific risk factors, matters most. Which leaves us wondering, are we overestimating the knife and underestimating our own body's amazing ability to heal?